The Alliance is not the board or the people who are working so hard in the national office. It's the thousands of people doing work on the ground right now. Um, it's the people who are involved in the consumer advisory groups that are being facilitated by state and territory peaks. Um, it's the people who are involved in the affinity groups that are looking at particular cohorts of people, particular identities, particular sector issues, and really focusing on those issues and bringing them to the national stage. It's a network of national policy experts, all with lived experience, who are working in the state and territory peaks and in the national office and bringing that collective wisdom to our efforts. Um, it is it is also the board, made up entirely of people with lived experience of mental health challenges, and of course a national office too. That again, I'd like to stress, very few people doing an enormous amount of work, and really having an influence um, uh, beyond what our resources would normally suggest that we could achieve. Um, but the important thing is that every submission we make, every reform we influence, every campaign we lead is only successful because it carries the weight of those thousands of voices and that those centuries of collective lived experience leadership. That's what makes the Alliance unique. It drives us to not tinker at the edges of a broken system, but rather rebuild it. And at the same time, be accountable to those communities we represent.